Good afternoon and welcome to our presentation, Leveraging Data Analytics to Optimize Scheduling and Resources in the Operating Room. Before we get underway today, I'd like to introduce my colleague, Derek Mudd. Derek is a consultant with Novia Strategies in our perioperative services practice. Derek consults extensively with our Novia clients in the area of technology and process improvement projects. He has recent experience leading multi-hospital organizations in implementing the Pyxis Supply Station technology in a variety of interventional service settings. And I'm Don Martin with Novia Strategies. I'm the technology practice leader for the organization and have similar experience leading Pyxis Supply Solution as well as materials management and enterprise resource planning implementation on behalf of our clients. A little bit about Novia Strategies. We're a team of clinicians and healthcare leaders who help hospitals and healthcare systems like yours improve operations, quality, and financial strength. Novia provides our clients with knowledgeable, experienced thought leaders to partner on a broad range of operational initiatives in the areas of care management transformation, human resources, non-labor expense reduction, pharmacy, revenue cycle, staffing productivity, surgical services, and technology. A little bit about what we will share with you today. We'll discuss the circumstances that led to the development of the supply forecasting and instrumentation analytic tools we'll be discussing with you. We'll touch on the data requirements and sourcing incorporated into the supply forecasting tool, together with an overview of the management of the tool itself. The work we've partnered with our client to date represents only a small body of the overall scope of work this client and others look to accomplish with their data analytic tools, and we'll review some of these with you. And finally, we'll make available to you a tool that will assist your organization in evaluating its need and readiness to develop similar data analytic and modeling tools. And just to set the context for this afternoon's discussion, in 2014, our client, under the leadership of the organization's perioperative and supply chain management teams, implemented the Pyxis Supply Station solution in ORs at several of its facilities. They did this in order to support the improved scheduling and availability of surgical supply and instrument resources in the OR. The implementation of the Pyxis system, along with corresponding staffing and operational process improvement changes, were intended to ensure that the OR staff had the right supply and instrument resources available to them when and where they were needed. At the completion of the project in 2015, the organization recognized that additional data analytic capabilities were needed to improve the availability, timeliness, and usefulness of supply, as well as instrument information available from the Pyxis, surgery, and instrument tracking systems. It's the development and use of these data capabilities we will be discussing with you today. Our discussion agenda follows the implementation path our client took when developing and implementing the tools we'll discuss with you today. This will include the pressing clinical and operational imperatives that drove the development of the solution design, as well as the design itself, implementation, and outcomes we see resulting from the use of this new platform. We'll also discuss with you future development initiatives and the lessons learned from our experience in developing this data analytic tool. Now to discuss catalysts for change. Our client estimated at the time of the Pyxis implementation that they were experiencing a 4% stockout rate for supplies needed within the OR. And while a 96% fill rate may seem very high, it meant for our client that there were over 2,400 missing items each month for which a substitute had to be identified and brought to the case. Or in some cases, a procedure would be delayed or even canceled. This was taking place at the same time that our client was taking steps to meet improved targets for first case on-time starts, as well as improved rapid room turnover. The chronic unavailability of needed supplies and instruments was undermining this effort. There was the opportunity as well to develop an integrated data model, particularly with the perioperative and materials management information systems, to gain the necessary information and reporting that neither system could provide without the other. And when this project got underway, the principal departments and stakeholders responsible for bringing the initiative to a successful completion recognized that they often operated in operational silos, and that it would be necessary for each of them to improve their scope and depth of understanding and knowledge of their peer department operations, as well as improve the quality and depth of their interdepartmental communications. With the implementation of the PIXA system, we learned that PAR and refill levels were based on order history and not actual case spec. And we also learned that there was a tribal knowledge-based shadow system in place that was not reflected in the physician preference cards and pick lists that were used to build out the PIXA system. One significant staffing improvement that was introduced with the PIXA implementation was the placement of supply chain staff behind the surgical red line in order to assume greater responsibility for supply service delivery in the OR and remove this responsibility from the OR clinical staff. In the process, supply chain gained an improved visibility into the supply service issues impacting the OR staff daily. And during the same time, the OR, supply chain, and central service leaders developed a service level agreement governing OR supply and instrument delivery services. This SLA developed clear guidelines for roles and responsibilities and established an increased level of accountability for the three areas. This increased accountability then drove the need for the use of improved data tools and automation to enable stakeholders to meet their agreed-to service commitments. Some of the challenges the team faced achieving success with this work. First of all, at the time the analytic tool development was getting underway, new leadership was being installed in each of the three departments. These leaders had not worked together previously, and time was needed for them to become oriented to their new role and organization, as well as to develop a collaborative leadership model to support supply and instrument service delivery in the OR. There were technical challenges as well. The organization had not previously developed the necessary integration between its surgical EMR and materials management information systems to support the supply forecasting tool requirements, nor did it have an available turnkey system it could leverage to build out the tool platform. And finally, as with all organizations, this was just one of many initiatives that each of the departments were involved with. Securing the necessary time and resources to accomplish this work was a challenge. Fortunately, through the formation of a steering committee and project management office, barriers related to the availability of qualified technical and operational resources were quickly identified and addressed by the organizational leaders. With regard to our desired outcomes, with this work the team was developing, our client team, under the direction of the project steering committee, focused its attention on physician preference card and pick lists, as well as scheduling and resource conflict checking. We sought improvements in stability with OR supply and instrument inventories and availability, as well as provide our end users with actionable operating data that they would find useful in their day-to-day operational management. The team also sought to provide needed information to our stakeholders to address longer-term supply and instrument inventory improvement opportunities. I'll now turn this over to my colleague, Derek Mudd.
Thanks, Don. We'll now look at the solution and design development portion of the project, and really the right data leads to the right answer. Next slide, Don. Our client believed that analytics were truly the catalyst for change. So the mandate we were given as we worked through these issues were that all solutions must be driven by data and the analytics of that data. This was to promote operating efficiencies and reduce cost and waste, particularly in the area of supply chain management. The need for dynamic reports and situational awareness of supply and instrument inventory was essential in avoiding service disruptions due to the rapid nature of the volume and utilization changes. Clinical stakeholders, including physicians and clinicians, respond to creditable operating data, especially when it's presented in a clear and concise manner that can be used in support of difficult conversations with both clinicians and physicians, whom we all know can be very reluctant to embrace change. As you'll see through an example later in the presentation, without integration between the information systems across multiple departments, data collection can and is time-consuming, as well as prone to human error when collecting for analysis. Next slide, please, Don. So the elements that we were looking for in our desired solution are as follows. We understood that the information had to flow accurately and efficiently between 3 separate departmental information systems. These included the surgery scheduling system, the surgery documentation system, as well as the instrument tracking and surgery supply inventory systems, in order to be able to compare and forecast supply and instrumentation demand and availability. Our available systems currently in use were Epic, Lawson, Materials Management Microsystems, as well as Microsoft Access to promote rapid tool development and implementation, as well as ongoing maintenance and refinement of those tools. As Don said before, using actionable data, we wanted to develop scheduled and on-demand queries and reporting capabilities, which clinician and staff could use in their normal clinical, sterile processing, and supply distribution work systems. We also made sure that we created actionable data reporting to ensure data-driven insights were contributing to the desired operational improvements.
These following two slides summarize the data requirements and sourcing for the analytic tool, as well as the development of the database tool itself. As we mentioned earlier, the team was able to source the desired supply forecasting data from available scheduling and case supply demand data available from the client's Epic Optime surgery system. Supply inventory data was sourced from the Pyxis Supply Station point of use management system. In the absence of a Pyxis, Omnicell, or similar point of use inventory management system, you can often find the same information readily available from your organization's material management information system. Instrument tracking data was made available from the organization's SPM Microsystems instrument tracking platform. Data requirements were compiled based on the business requirements provided by our OR customer. In order to ensure the accuracy and integrity of the data being provided, we put measures in place to ensure the quality of the procedure scheduling and supply inventory data in the Epic and Pyxis systems. We developed the supply forecasting tool using Microsoft Access. Our team was familiar with Access and had the necessary skill set to build and maintain the required data tables, queries, and reporting components. Because the end users of the data were also in many instances responsible for the data entry into those systems, they understood the value of the data was only as good as what they were entering into those systems. The project team put measures into place to routinely validate the data imported either electronically or manually by staff into the forecasting platform. This slide shows the surgery supply, demand, and availability data flow between the various surgery and materials management applications. This slide illustrates that data flow that provided inputs into the supply forecasting tool. Our clients provided informatic analysts who extracted procedure data, scheduling, supply, and instrumentation demand, as well as supply consumption from the organization's Epic Optime system. This data was then imported into the Access database tool. Inventory data was similarly extracted from Pyxis and imported into the database. The supply, demand, and availability data was then organized and processed in the database to provide our clients and users with daily updates on any supplies that would not be available for procedures the following day. The system also provided reporting that enabled our end users to look at and adjust par level and reorder points in the Pyxis system. This slide you're now seeing is an actual representation of the reporting menu contained in the Analytic tool. As you can see, end users from each of our clients' interventional areas are provided with reporting related to supply availability, as well as par and refill reorder point data. You'll also see in the middle bottom of the menu display that our end users were also provided with a reference containing a listing of supplies with known substitutions. This way, in the event that a needed supply was not available per the daily forecasting report, end users could identify and order an agreed to equivalent product. This slide illustrates the supply-demand requirements as represented by the procedure pick list on the left side of the slide. This was then matched to the inventory availability for that same supply contained in the Pyxis system showing on the right hand of the slide. To best understand it, we need to walk through the order of operations when it came to supply ordering, picking, and replenishment. In our client's environment, the supply replenishment order was placed each day at 11 a.m. This was to replenish supplies consumed the previous day. Actual replenishment occurred the next day as supplies were delivered from either a central distribution center or from a third-party vendor. In between these two, case picking took place just 6 hours after the replenishment order was placed. This schedule was fixed, and the organization was always at risk to fulfill supply requirements with inventory that had already been depleted through activity from the previous day. But if our client could forecast what was needed for the next day and instantly compare it to what we had on the shelf, this provided us with options. Our client could either reach out to sister facilities for supplies, or they could also identify substitutes that would suffice. And they could do both a day in advance of the scheduled procedure, eliminating much of the 11th hour scrambling for supplies and instruments that we often see in our clients' environments. Worst case, we could talk to the surgeon in advance to determine if other options existed. As I explained earlier, data was extracted from both Pyxis and Epic and placed into tables within the Microsoft Access database, and then connected to the relevant fields within the database. We then set report criteria to help us find what could be our immediate problems. As you can see in this illustration in this slide, the scheduled demand for the Drake Basin solution warmer for the next day cases was a quantity of 4. The forecasting tool revealed that there were no warmers on hand in the Pyxis system, having been consumed with the previous day cases. One of the benefits of building the forecasting tool in Access is the fact that we can quickly adjust report parameters and settings to gather and report whatever range of information we wanted. If someone wanted a report sorted in a different way or another piece of information, it was easy to make that adjustment, generally on the fly. For example, most OR nurses are taught when you go to grab a supply, don't get just one. So we set up our reports in the same way. When we compared all items we planned to pick or take off the shelf to what we believed was on the shelf, we could see any supply that had 2 or less remaining. And we could adjust these then to 3, 4, or 5, or whatever worked best. Our efforts worked, but having to continually intervene to ensure sufficient on-hand supplies, even a day in advance of a scheduled case, was really just a temporary solution. So we refocused our attention to fixing even bigger issues. Consider, for example, that the definition of PAR is the maximum level of supply that is kept in inventory. We developed a report to bring to light any supply being picked that had a total need or demand quantity greater than the established PAR for that item in the Pyxis system. To say it simply, if you need 12 tomorrow and the maximum quantity on the shelf is 10, you won't have the sufficient number you need the following day. The PAR level report enabled our materials management staff to track and trend supply demand against current PAR levels and make necessary adjustments over time that would reduce and in some cases eliminate chronic shortages. This meant that the day-to-day adjustments that materials management, the OR staff, needed to make to ensure adequate supplies were on hand over time were reduced. In addition to adjusting our PAR levels, we looked at longer-term solutions for our refill and reorder points as well. If PAR is the maximum amount of supply on the shelf, then the definition of a refill point is the minimum level of supply that can exist before a reorder is triggered. As I pointed out earlier, our client's replenishment order was placed at 11 a.m., case picking began at 5 p.m. that afternoon, and supplies would arrive between 5 a.m. and 8 a.m. the following day. The supplies needed should be on the shelf in the quantity needed before the case picking even begins. This was perhaps one of the most critical reports we had to correct our problem. Looking at the first example, the need for packing nasal string is 12 and the refill point is 5. The reorder would not have taken place unless there were 5 or less of these items on the shelf. In essence, you could have any amount of a supply between the reorder point of 5 and what you needed, which was 12. What would happen, for example, if you only had 6 of these items on the shelf? The replenishment for that order would not even be placed. And not only would you not have enough of that item to fill the case cards, you wouldn't even have more of those coming in. We learned that we needed to adjust the refill points to ensure that they were equal to or greater than the needed quantity. Once these were corrected, we had a lot less issues on a daily basis. And by running the report daily, we could keep up with changing trends, new surgeons, and increased case volumes, particularly during our busier seasons. This graph represents our supply availability from the inception of the use of the forecasting tool through the first several months that it was in place. At the time of our initial measure, our clients had, on average, a 96 to 98% fill rate, as shown in the graph. That doesn't sound so bad, again, until you consider that we picked 60,000 supplies in a month, and at a 4% of supplies missing, this equated to 24 missing items per month. To make that meaningful for you, that represented between 80 and 120 missing supplies each day. You can also see that initially there was significant volatility in fill rates. Once the forecasting tool was in place and the staff began to use the available data to address daily shortfalls, as well as make the longer-term adjustments to the more impactful PAR and reorder point levels, not only did our clients achieve improved fill rates, but the volatility was significantly reduced as well. And as you can see, fill rates leveled at between 99.5 and 99.8%. If you apply those same calculations as before, it resulted in about 300 missing items per month, or about 15 per day. And that's just not 15 different items missing per day. It's a total of 15 items, total items in a day. And our client had the benefit of knowing what those missing supplies were 1 to 2 days before the scheduled case. Now I will turn this presentation back over to my colleague, Derek Mudd.
Thanks, Don. Data analysis is not a new concept for sterile processing leaders, and we are very well versed in using reprocessing information to improve overall utilization of instruments, as well as supporting strategic instrumentation purchasing decisions. One of the ways that we put this into play is through the analysis of immediate use steam sterilization data, or IUSS. We use this as the key indicator of our overall instrument availability, and this gives us a strategic edge by using the data to support decisions for purchase or prioritizing needs. IUSS analysis positively impacts the percentage of IUS. Simply looking at the items which are being IUSS each day shows you which items you have a low availability of. It also allows you to identify vendors who may be out of compliance in regards of vendor tray arrival, impacting on how quickly that instrument is available for surgery. It also identifies some potential scheduling adjustments that may be made to address limited instrument inventory, especially those high-priced instruments that all ORs have. Analysis of IUSS data also provides data to back up physician discussions around instrument set standardization and consolidation, which may ease that burden of low availability of instrumentation. Next slide. So I'm going to walk you through the compilation of that IUSS data so that it can be used to leverage and review the resource allocations. To begin with, our client put into place standard reason codes, and this allowed us to gather quantifiable data. That data is then collected daily from sterilization records within the OR at each IUSS autoclave. Staff performing the IUSS must accurately record the items that are being processed to provide accurate data. That's when the standard reason codes are used, and each staff member who were utilizing IUSS had to use one of these codes to identify why that item was being used or was being IUSS. Case identification information associated with the IUSS occurrence allowed for further drill down in regards to commonalities within the occurrences. And then the analytics were performed and a report was generated for OR leadership. Next one. This slide represents all of the data points that are used in tracking instruments through the full reprocessing center. This graphic shows a very large system with an off-site reprocessing center. These scan points, though, are very much the same, except for the shipping portions, as any hospital sees in its reprocessing. The key takeaway is that the data had to be accurate and it had to be dynamic across all of the scan points in order for us to accurately track where instruments are and whether they're ready for the case. This graph shows the drill down from the analytics for IUSS for the client hospital. And as you can see, the largest portion that was identified were hospital-owned items. Those items that the hospital obviously owns and has charge of. And it shows that a portion of those instruments were just general instruments that the facility owned. However, a portion of those instruments were doctor special sets. So with this drill down, next slide please, we were able to identify opportunities within the facility for purchasing additional instruments that were needed most. They were able to adjust the own set inventory to accommodate volumes, which led to the decision to purchase additional 5 power sets. We also identified the doctor specialty sets, and we were able to add a 4th physician specialty set to accommodate volume. The client was also able to furnish utilization data to justify the instrument purchases. As you can see, walking through this, without an automated system in place, this process can take a great deal of time as well as resources to compile. However, with an integrated system, you can store and mine data much more efficiently for reporting purposes. So now we'll talk about the benefits of integrating that system. As you can see by what our team worked through to create the analytics for supplies and the time that was spent there, this time period is similar to the work needed to gain similar information for other resources that were having integrated systems in place can be of great benefit. Today's instrument tracking systems have many benefits that exceed the capabilities of systems which may be currently in use in most facilities. Today's instrument tracking systems, if integrated with surgery scheduling system, can play a much larger part in planning and strategy for the OR and sterile processing alike. The system's integration functionality can aid in the management of required data documentation, such as quality assurance monitoring, sterilization parameters, biological testing results, as well as quality testing are documented automatically into the electronic sterilization record. Data interface and integration with OR scheduling systems with a bidirectional flow allow for continuous updates in terms of set name, set contents, static as well as dynamic inventory levels. Surgery scheduling and instrument tracking system integration also allows for set and item traceability back to the last patient through documentation of such use within the patient's EHR, or electronic health record. As both surgery scheduling and ITS systems continue to evolve, it is becoming very evident that the information and data capture capabilities will be integral in improving outcomes by aiding in exact root cause analysis for identified SSIs. Next slide, please. As Don walked you through the data flow between the surgery scheduling and information systems and material management system, this slide represents that flow between the surgery information system and the instrument tracking system. As you can see, patient scheduling data and instrument pick lists from the surgery information schedule flow into the instrument tracking system. With that being in mind, the instrument tracking system also updates the surgery information system with set name, set contents, dynamic and static inventory. With fully integrated systems, this then provides instrumentation next day tray needs forecast, instrumentation processing priority list, which are the trays that need to be processed first, which will be needed first. And it also allows for needs to be documented as soon as the case or procedure is scheduled, allowing long-range forecasting as cases are booked. And in our client's case, this was only good for about a week due to the changes in scheduling that could happen any further out. And I'll hand it back over to Don. And I'm sorry.
Ongoing data analytics development focus. As I mentioned early on, the work that Derek and I have spoken to today was just the first and initial efforts on the part of our client to build out data analytic capabilities in the surgery, materials management, and central sterile services areas. So we wanted to give you a little bit of visibility into the additional areas for opportunity for analytics. The first is, and very critical to surgery and the OR staff, is the ability to use both inventory and supply consumption as well as instrument consumption data to re-engineer more lean preference card pick lists. We found in this client setting, for example, that anywhere from 15 to 20% of their case pick was returned back to inventory that same day or following day. This, what we believe to be excessive return levels, tended to confuse and make the inventory levels available in the Pyxis system less than useful. And as a result, using data of consumption as well as what was in the inventory system is an opportunity for the organization to develop more lean preference cards as well as improve case pick efficiency, reduce supply waste, and return. We also can use consumption data to understand and provide physicians with their usage data and present them with data that's creditable and current so that they can look at variance and standard supply standardization opportunities within their own work. Derek, you want to speak to lessons learned?
Sure, Don, thank you. Very early on, we realized that forming a multidisciplinary steering committee was very necessary in maintaining development focus and facilitating any request priorities. As Don spoke to earlier, all facilities are very tight on resources when it comes to projects, and many of them have many projects going at once. Forming the steering committee allowed us to prioritize our requests so that all of the key stakeholders would know what we were working toward and what needed to be done next. We began with small, focused initiatives. This allowed the team to rapidly build competency as well as trust amongst the team, and this also shortened the development cycle. These small, focused initiatives allowed us to gain early operational success, which really bought us trust from the staff to rely on our analytics rather than the tribal knowledge they had been used to using. And lastly, in order to gain any approval for projects such as this or to leverage data analytics such as this, you must show clear quality, operational, and/or financial value in order to gain that approval from senior leadership for a project such as this.
And finally today, we want to talk with you a little bit about a take-home tool that Derek and I can make available to you so that you can develop your own data modeling readiness checklist. So as an adjunct to this presentation, we've developed a planning tool that provides you with some insight into some of the key considerations that we encountered, including organizational, operational, and technology considerations and requirements that our project team evaluated during the design and implementation phases of this project. I'd like to emphasize that taking the necessary time and effort to secure organizational support for this work, as well as to foster collaboration and trust among the operating room, central sterile services, and supply chain organizations is a necessary requisite to a successful implementation and ongoing adoption and sustainability of both the supply inventory and instrument forecasting tools. This tool that we can make available to you will share clinical and operation requirements that drove the analytic tool feature and functionality design and development, the inventory of information system sources developing and containing data relevant to the building of this analytic tool. We'll also provide you with a listing of sample data extracts sourced from each of these systems, as well as a sample of the database tables, query structure, and components embedded in the tool. And finally, we'll provide you with online queries and reports produced from the data analytic tool database that our clients use, that we describe to you on a daily basis to support both day-to-day inventory requirements as well as to address the longer-term PAR and reorder points, as well as instrument management planning that Derek discussed with you. We want to thank you again for joining our webinar this afternoon. Derek and I hope you found this information useful. And if there's any way that we can provide you with additional information or discuss with you in further detail the work we did with this particular client with this initiative, we're more than happy to share this with you. Thank you and have a good afternoon.